Okay, I think we're going to go ahead and get started. Welcome everyone. For those of you that don't know me, my name is Shannon Udy. I'm the PSC Health Educator for the Great Plains Good Health and Wellness Program. And I'd like to thank you all for joining us today on our monthly webinar. This month we have Terra Houska, who is our own tobacco health educator, presenting today on traditional tobacco versus commercial tobacco. This presentation will explain and define traditional tobacco in the Great Plains region. It will also cover the differences between traditional and commercial tobacco uses. Commercial tobacco is produced for recreational use by companies, contains chemical additives, and is linked to death and disease. After this presentation, you will be able to define the differences in the importance of traditional tobacco and why creating policies in tribal communities is an important key to assure that communities are protected from health disparities caused by cigarette smoke. Before I pass it over to Terra, just a few housekeeping things. Please make sure that you're muted during the presentation. There will be time at the end for questions. If you're on a computer that doesn't have a microphone and you do have a question, you can always type it in the chat box and I can read those for you. So with all that being said, welcome Terra.
Hello everybody. Like Shannon said, I'm Terra Houska. I'm the Tobacco Control Health Educator here. And I am going to, can you see the screen all right?
Not yet.
I think okay. Okay, got it.
Okay. Oh, yeah.
You can see it now?
Yep.
Okay. All right, so today I'm going to start talking a little bit about the definition of commercial tobacco, the definition of traditional tobacco. I'm going to go over a little bit about the commercial tobacco use in the Great Plains, the 4 different states that the Great Plains Tribal Chairman's Health Board covers, and some of the smoking statistics from those areas. I also want to go into the economic impacts of commercial tobacco and some of the health disparities of commercial tobacco. And then I want to end it in explaining why the tobacco policies, creating them in a tribal community is important. So traditional tobacco definition. Traditional tobacco is tobacco and or other plant mixtures grown or harvested and used by American Indians and Alaska Natives for ceremonial or medicinal purposes.
Great Plains.
There's a variety of traditional tobacco that the different tribes of the Great Plains use, and in this presentation, traditional tobacco is referred to as the plants that the Lakota Dakota use as offering smoking during prayer and ceremony. And not just the Lakota and Dakota, but some of the other tribes as well. Commercial tobacco, it is produced for recreational purposes by companies. It contains chemical additives and is linked with death and disease. It is sometimes mistakenly used in place of traditional tobacco for ceremonies. And these are just some of the chemicals that are in commercial tobacco. I know a lot of you have seen this, but there's like household cleaner, rat poison, rubber cement, battery acid, rocket fuel. I think there's also stuff that's used in batteries. You can kind of just see the different types of things, chemicals that are in commercial tobacco that are added to the natural tobacco. Traditional and commercial tobacco are different in the way that they are planted and grown, harvested, prepared, and used. Traditional tobacco is and has been used in sacred ways by American Indians for centuries. Its use differs by tribe, and Alaska Natives generally not using traditional tobacco at all. In these photographs, you can kind of see on the left, it's where traditional tobacco grows. If you look in the back, you can see this is where the chinchasha grows. It's the red sticks in the background along the stream. And then the commercial tobacco, you can see right here, it's all planted in crops. And so these crops also are, they use herbicides, pesticides, and those type of things, chemicals, different things to make them grow. So not only do they add the chemicals when they become cigarettes, but they also are exposed to those chemicals while they're growing in crops. Another topic I like to bring up is the cultural appropriation from the tobacco companies. They use our figures, our artwork to promote their products, and it's kind of a weird coincidence to me that Native Americans also have the highest prevalence of cigarette smoking compared to all the other racial groups, and they use our artwork to recruit us for smoking as well, and to use it for our ceremonies. And some of these are the all-natural tobacco, like the Natural American Spirit. They say it's all natural tobacco, but yet they don't release what is in their natural tobacco, so we really don't know what's all in it. And then the other smoking cigarette brands and the tobacco cards, they use those to help get people to do it like it's a natural thing, not necessarily a bad thing. Some of the misconceptions about traditional tobacco. Traditional tobacco is not inhaled. When it is smoked in prayer, it's held in its mouth, and when it's blown out of the mouth, the prayer is sent up with that smoke up to the spirit world, and that's how the prayers are traveled. So it's not inhaled. The commercial tobacco originates from South America. I know the tribes in South America would use tobacco, but they would chew the leaves. They wouldn't smoke it. It was used a lot differently than what the commercial tobacco companies use it for. 7 uses of traditional tobacco: ceremonial, social, prayer, to smudge, for medicinal purposes, for gifts, and for trade. These are the 7 most common uses of traditional tobacco in the Great Plains area. Traditional versus commercial. If you can see the pictures of both of them, they look a lot different. And also the traditional tobacco, when it's used, it's all natural. There's nothing in it. It's not chemically modified. And it also has nutritional values, and it's free. It doesn't cost anything to go out there, maybe gas money and time, a lot of time to collect it and prepare it. In commercial tobacco, it causes cancer, emphysema, breathing problems, heart disease, and also preterm birth if it's used by pregnant women. It contains nicotine and carbon monoxide. If you're smoking it, you get the carbon monoxide poisoning. And it's also made only for profit. So chinchasha, and I don't know if I'm saying it right, it's asema. It's used by the Lakota, Dakota tribes, and it's also used by the Chippewa and Assiniboine, called asema. It's the red osier dogwood, and I didn't go into a lot of detail about the biology of this plant because I did that in my webinar last year, and you guys can see that online, I believe. And it is found near water, and it has a very noticeable bright stem. In the Lakota and Dakota tribes, we usually gather it after the last thunder and before the first thunder. And usually when the plant is dormant, from January to February is the best time to collect it. And this is some information that I got from a HoChunk elder out of the Michigan area through their health board on that side. I wanted a little bit more of an understanding. I'm still learning more about how the HoChunk people use their tobacco. and what they use it for. And so this statement was given to me by them, this elder, and she said, much different than the smoking tobaccos used to destroy our bodies today. And I don't know if I'm saying this right again, but tawny is one of the most sacred gifts of spiritual medicine to the HoChunk by Earthmaker. We are instructed to offer tawny for thanks and to give others tawny for knowledge they may hold that would benefit us in return. In doing so, you please Earthmaker for utilizing the gift given to us for this purpose. Traditionally, certain men are given the right to grow tawny for use, and they're instructed to care for the tobacco plant in a certain way for it to retain its special properties. When you offer tawny, this is a good thing that is respected amongst those who know of its power and significance. And the plant that is used for their tobacco, the HoChunk tobacco, is similar to, I think it's from the same family as the tobacco plant that some of the commercial tobacco companies use, but I believe it's a different one that the tribes have been using. But it's not the willow like those of us in South Dakota or North Dakota use. So talking about some statistics, Iowa, in 2016, 16.7% of adults smoke, and their tobacco taxes is $1.36. The amount that the state is spending on healthcare costs is $1.28 billion a year, and the amount they lose in productivity is 1.21. So the way they get that loss in productivity number is by the amount of people who are missing work because of smoking related illnesses. The total Native American population in the entire state of Iowa, and that's all tribes, is 15,924. And the smoking rate for Native Americans in the state is 53.4. So Nebraska, 17% of adults smoke in the entire state of Nebraska. Their tobacco tax is a lot less than the Iowa one at 64 cents. The smoking cause-related healthcare costs, $795 million a year. The loss in productivity is $605.5 million a year. The Native American population is at 29,816. That's 2010. That was an older number. That was one of the more recent numbers I could find. And the smoking rate is at 37%. South Dakota, 18.1% of adults smoke. The taxes are $1.53. Healthcare costs are at $373 million. Loss in productivity, $282.5 million. The Native American population in the state is 71,800, and the smoking rate is at 44%. North Dakota, 19.8% of adults smoke. The taxes are at 44 cents. $326 million a year in healthcare costs. $232.6 million a year in the loss of productivity. Almost 40,000 people in North Dakota, or Native American people in the state of North Dakota, and the smoking rate is at 47.9. So I think the highest rate of smoking was Iowa, and Nebraska being the smaller one. Iowa, it's a really high number for the like the population size there within the state. Smoking will cost you. A lot of people know smoking is expensive. So this is what, based on the price of cigarettes increasing 6% annually, one day If you quit smoking, you'll save $6.28. After a year, it's about $2,292. So you can kind of see, like, just from an individual quitting smoking, how much it'll save them and what you could possibly spend that money on if you did quit smoking. Other costs attributed to smoking. Insurance rates, housing, healthcare, and deaths are the biggest costs attributed to smokers. Insurance, if you are a smoker, you'll typically pay 15 to 20% higher rates than non-smokers. HUD housing. The HUD housing, a lot of the reservations across the states have HUD housing. Nationally, HUD housing spends $153 million a year in repairs related, or that's just all repairs, and $16 million for costs tied to smoking related fires. So if you can think about how much, if people weren't smoking in the HUD housing like they're not supposed to, then those costs would go down and possibly be more, there would possibly be more housing available or more housing built for our people. Healthcare. Using recent health and medical spending surveys, researchers calculated that 8.7% of all healthcare spending, or $170 billion a year, is for illnesses caused by tobacco smoke. And public programs like Medicare and Medicaid paid for most of these costs. Deaths. Cigarette smoke is responsible for more than 480 deaths per year in the United States, including more than 41,000 deaths resulting from secondhand smoke exposure. This is about 1 in 5 deaths annually, or 1,300 deaths every day because of smoking. Some of the health risks in Native American populations. Cardiovascular disease is the leading cause of death among American Indians and Alaska Natives. Lung cancer is the leading cause of cancer deaths among American Indians and Alaska Natives. Diabetes is the 4th leading cause of death in American Indians and Alaska Natives, and the risk of developing diabetes is 30 to 40% higher for smokers than it is for non-smokers. Secondhand smoke, most of us know the dangers of secondhand smoke. It's really dangerous to children and even elders with existing lung problems. Children who are exposed to secondhand smoke are at higher risk for middle ear infections, asthma attacks, and babies and children younger than age 6 who are exposed to secondhand smoke regularly are more unlikely to get respiratory tract infections such as pneumonia or bronchitis. Third-hand smoke. Third-hand smoke is when somebody smokes and then goes in, holds a child or is near a child, and that child, or anybody really, not necessarily a child, breathes in the smoke from their clothing or their body. It can stick to walls, carpets. So if you smoke in a room and you leave the room and that somebody else comes into that room, they could be exposed to third-hand smoke as well. So one thing that I really want to emphasize in this presentation is why it's important to develop tobacco policies in tribal communities. Going over traditional tobacco compared to, or in comparing it to commercial tobacco, you can kind of see like there's a lot of things wrong with commercial tobacco, and there's a lot of benefits to traditional tobacco. So like when you look at the two, it seems like a no-brainer that, you know, we need to emphasize the use of traditional tobacco and stop using commercial tobacco. Well, in order to stop using commercial tobacco, we need to develop these policies in tribal communities so we're not exposing children and other people who aren't smokers to the dangers of commercial tobacco. So it's also important because Native Americans lead the U.S. in smoking out of all of the other demographics in the U.S. Second, third-hand smoke puts innocent children at risk of disease. And the economic impacts of smoking and other tobacco use could save tribal communities money for other programs in need. So one thing that we do here at Great Plains is help a lot of tribal communities develop policies for their tribes. And these are some of the sample wordings that I really liked that I pulled out of some of our policies that we have on here. Is no smoking or other use of tobacco products, including but not limited to cigarettes, pipes, cigars, snuff, e-cigarettes, or chewing tobacco, is permitted in any part of the building or in vehicles owned, leased, and rented by tribe. That statement's pretty common in most of it, but I like it how it includes the e-cigarettes, the snuff, all of that. And then the second one, smoking of any kind, including e-cigarettes, is prohibited in all indoor areas, doorways, or in the direct line.
See how much money I have.
Of
How about if I
children.
donate? I don't really want the
Employees-
sugar cookie because I made cookies and I hope I
Employees are asked to smoke only in designated areas. All cigarette butts are to be properly disposed of in proper receptacles. This one I really like. It comes from a school because it says do not smoke in the direct line of sight of children. That one is one of my favorites. So we can help you develop a policy that fits the need of your community. If you email me, call me, let me know what your concerns are. If there's second, third-hand smoke, smoking in front of tribal buildings, which we see a lot of, smoking in cars, or even smoking in housing. We have sample policies for housing as well as tribal buildings. This is a model I really like to share. It's a model that was developed by the Chonli Coalition and the Missouri Breaks. And they are out of the Cheyenne River Sioux Reservation, and they're the first reservation in the state of South Dakota to become smoke-free. So this, it just kind of shows how they use their coalition to collect data, raise awareness, develop policies, present policies, take those policies to tribal leadership, and then to enforce those policies. Updating policies is something that we also like to do and help assist tribes to do. So a lot of policies don't say anything about no smoking within the sight of the child. Some of them don't include the e-cigarettes, vapes, or hookah. And a lot of policies don't even mention the use of traditional tobacco. And I think that's something that's important that should be included in there and defined in the policy. Enforcement of policies. This is an area that we see all tribal communities struggle with. So something that we've done is help develop signs with the language. We have them in Lakota, Dakota, and in the HoChunk language on the Winnebago Reservation. Developing these signs and seeing artwork from local artists or just designs from the area. I think a lot of people have a little bit more respect for them when they see those signs. Another way to get enforcement of those policies is by leadership support. If you have leadership support, tribal leadership to support your policies, then it makes a huge difference. Yourself, you can enforce policies yourself. Just asking people, I know it's hard to do, just say, hey, did you know that you're not supposed to smoke in front of here? Or, you know, we'd like you not to smoke in front of here or around me, you know, that's not you're not supposed to smoke here anyway, and I would appreciate if you didn't. I know it's hard to do, and even I myself have a hard time saying it, but that's something that everybody should try to work on, I think. Community events to spread awareness. I'm seeing more information on people who are doing events that are promoting smoke-free environments like walks or 5Ks, or even if they do dinners webinars, lunch and learns, those type of things. Any of those community events to spread awareness of those policies, I think, is important. Promoting cessation to tribal members. Bringing in workshops and trainings to your community to help those trying to quit, and to also train healthcare providers to assist smokers to quit. There's a lot of trainings out there, and if you want information, you can always email me or call me to bring these workshops and trainings to your community. You can get your healthcare providers trained, employees trained to assist smokers to quit smoking. You could host quit events like the Great American Smokeout or Kick Butts Day. You can do the 5Ks, you can do feeds, you can do any type of event during those days. I think is a really good way to promote cessation. And then use the resources that we develop here at the Health Board and distribute in hank posters, not hand posters. Sorry about that. But handing out those materials, using these quit lines here. I know these quit lines all have like a pretty good success rate. I know South Dakota is #2 in the US, and I like to brag about that, but these are all great ways to help people to stop smoking. Other things to do in your community, encourage the use and importance of traditional tobacco. I think a lot of tribal communities, everybody knows that tobacco is sacred. And I think a lot of people don't understand how using commercial tobacco is not sacred and what it's really doing to our people. They don't see the big, broad picture of it. Another thing is to create smoke-free community events. So if you're hosting a powwow, sporting event, even a funeral, I know it's hard to ask people when they're grieving not to smoke cigarettes, but even just say, hey, could you take that outside? Powwows, creating designated smoking areas, sporting events, no smoking outside of the doors, you know, just little things like that, just making it a smoke-free event and promoting that. Also collecting, preparing, and educating about the uses of traditional tobacco. I think this is really important. I know a lot of the tribes do this. They go out and they collect the traditional tobacco, they prepare it. And I know the state of South Dakota, we worked on developing a traditional tobacco toolkit. And within the state of South Dakota, it is available, and I have one here with me. So if you're from another state and you would like to borrow it, we could send it to you to use. And it has a lot of information about the traditional tobacco, where to find it, and we even have samples of the tobacco, what it looks like, and the different stages it looks like while before you shave it from the willow. Also encouraging tribal leadership to back up policies, increase taxes, and create new policies. I know the Turtle Mountain Band of Chippewa in North Dakota has a separate tax, tobacco tax, and that money goes back to the tribe. So I think that even tribes looking at possibly doing that for the reservation and using that money to go back to tribal programs that encourage not smoking, anything like that. Here's a few more sources that I have on here. The National Native Network is a great resource for tobacco, especially traditional tobacco. Truth Initiative is also a really great resource, and the CDC. Anybody has any questions? I kind of went through that pretty fast, but.
Great, thank you, Tara. Yeah, if anyone has any questions, please feel free to ask them or type them in the chat box. I also just put our evaluation form in the chat box, if you could fill that out before jumping off. We have a question, Tara, that says, can we get a copy sent to us?
Of the PowerPoint?
Um,
Yep, we can do that. I can put it in a PDF form and you can send it out, Shannon, with the follow-up email.
Yep. If you are new to this webinar, if you've never joined us before, if you want to put your contact information in the chat box, that way we can add you to our list. We send out the recording of this webinar in a follow-up email, and we also put it on our YouTube page. So I can add anyone onto our server list if you'd like a copy of this.
Terra, can I ask a question?
Yes.
Can you talk a little bit about the state quit lines? Do you know, you talked about South Dakota being one of the top rated ones. I'd be interested if you know this information about what that process is like if somebody calls that number. Like, do they refer out to other cessation and prevention opportunities? Or what are kind of the follow-up steps after someone reaches out to one of those quit lines?
I know it varies kind of by state, but with the state of South Dakota, when they call, they get a coach.
Mm-hmm.
They sign up, they do an assessment and see like where they're at. The state sends them 2 weeks of a nicotine replacement therapy to assist with the quitting, and then I think they have like follow-up things. So you can like opt to get like a coach that texts you or emails you, sends you alerts. So it's really kind of like what you want from them.
Okay. Cool. Thank you.
But I think Nebraska's similar, and I'm not as familiar with Iowa
Okay.
North Dakota. I know they pretty much all of them give some sort of replacement therapy and do like follow-up, but a lot of it depends on what you want from them.
Okay. Thanks.
Yep.
We have one other question in the chat, Tara, that says, where do you get your smoking prevalence data?
I'm trying to remember. A lot of it came from the Truth Initiative and the CDC.
Does anyone else have any more questions for Tara? All right. Like I said, there is at the top of the chat box our evaluation survey. Just follow the link to that, please, before logging off of our webinar. And be expecting a follow-up email with the recording of this webinar and the link to our YouTube page. And thank you all for joining today, and have a great day.